Hello, Mr. Jackson. Nice to see you. My name's Dr. Ahmed. I'm just going to examine you today, if that's okay.
Yes, that's fine.
Fantastic. Okay, I'm just going to start by taking a step back and having a look at you. Okay, can I start by having a look at your hands? Is that okay?
Yes, certainly.
Just going to turn your hands over and we'll have a look at both of them at the same time. Okay, thank you. And just turn your hands over for me. Okay, thank you. I'm just going to have a feel of your pulse and your wrist, if that's okay. I'll feel both together. Thank you. And I'm just going to have a... Do you have any pain in your shoulder?
No.
Just like to raise your
I've got
arm.
arthritis in all the joints, so...
That's fine. I'm just going to raise your arm up, but let me know if you've got pain.
No.
Thank you.
Nothing. It's not normal. You know.
That's fine. So I'd normally check the blood pressure at this point. I'm just going to have a look at your face and a look at your neck, if that's okay.
Yeah,
Can I ask you just to pop your glasses off for
Yes,
me?
certainly.
All right. Ordinarily, I'd get the patient to rest their head against the back of the bed, but it's not really possible for you to do here. The bed's a bit too short for you. So if you just turn your head slightly towards that side for me, I'm just going to have a look at your neck. Okay. I'm just going to press on your belly, if that's okay. Keep your head that way slightly. Okay, that's fine. Just going to have a look at your face now, if that's okay. So if you can just look at me, I'm just going to start by looking at your eyes, cheeks. And if you can just open your mouth for me and tongue up to the roof of your mouth. Thank you. Just going to have a feel of the pulse in your neck now, if that's okay. Yes, please. In fact, you can come back a little this way. That's fine. So I can feel the carotid pulse. Feel the subclavian. Yep, that's fine. Just going to have a feel of the front of your chest, if that's okay.
That's fine.
So, okay, just going to have a feel at the bottom of your heart. Thank you. It's fine. Just going to have a listen now, if that's okay.
Yes.
I'm actually palpating the subclavian artery rather than the carotid because it's easier for me. What I'd like you to do is just put this left arm just above your head, like that. Okay, and just roll slightly onto your left for me. Okay, breathe in, breathe out, and hold it. That's fine. Breathe normally. Just stay on your left for a second. That's fine, thank you. You can pop your arm down now. What I'm going to ask you to do is just to sit forward for me. That's perfect. So if you can stay like that for a minute, take a breath in, breath out, just hold it there. Do that again for me. And out, and hold it. That's fine, thank you. Just whilst you're there, I'm just going to have a listen to your neck. So breathe in, breathe out, and hold it. That's fine, breathe normally. And once again. And hold it. That's fine, breathe normally. Thank you very much. Whilst you're there, I'm just going to have a look at the back of your chest, if that's okay. And I'll just have a listen of your chest. Deep breath in and out. And just sit forward for me a little further. Just have a feel of the back. Just relax back for me. And you can put your glasses on. Just going to have a look at your legs. Just relax. Is that painful at all?
No. They're well under control, actually. I go 3 times a week for treatment for them. Yeah.
Okay. That's fine. Thank you. We're all done there. I'd go on to assess the peripheral pulses, assess for any radiofemoral delay that I've not yet done, check for a pulsatile liver, check the patient's temperature, pulse and respiration chart, dip his urine also. On examining Mr. Jackson today, his pulse is between 70 to 80 beats per minute and is regular. There are 2 scars here in the precordial area. He has a loud metallic first and second heart sound with a soft flow murmur in the aortic area. There are no other findings posteriorly and no evidence of any heart failure when auscultating his chest. He does, however, have evidence of peripheral edema and chronic venous change affecting his lower legs. Mr. Jackson appeared comfortable when he was examined. He was a good colour and breathing at a good rate. Clinically, he was in sinus rhythm and he had evidence of 2 median sternotomy scars. Interestingly, there were no vein grafting scars of note. It was clear to hear that he had indeed 2 metallic heart sounds, a metallic S1 and a metallic S2. There was a soft systolic murmur in the aortic area that did not radiate to the carotids. There were no carotid bruise, and whilst there was evidence of mild peripheral edema, there was no evidence of any pulmonary edema or cardiac decompensation otherwise. There was evidence of chronic venous skin changes of the lower limbs. In summary, Mr. Jackson has a metallic aortic and mitral valve prosthesis. There is evidence of 2 median sternotomy scars without any vein grafting scars, which would raise the possibility of a double valve operation in the past. There was also evidence of mild peripheral edema together with chronic venous skin changes of the lower limbs. When you first approach the patient, it's important that you expose them adequately. Expose the chest, but also roll up their trousers if they're wearing them. It's important to give yourself as many clues as possible. So when we looked at Mr. Jackson, it was quite evident that he did indeed have 2 median sternotomy scars, not just 1. Have a look around the sides of the chest for any scars at the sides or posteriorly. When you roll the legs up, it's going to be evident to you whether or not they've had vein grafting scars, which may raise the possibility that the scar was due to bypass surgery. However, in this case, he didn't have any vein grafting scars, making it obvious that he's had a valve replacement in the past. It was quite clear to hear before you even put your stethoscope on the patient, just whilst observing him, that there were indeed 2 metallic clicks. It's important to time the clicks to decide whether or not it's the first or second heart sound that this relates to. The fact that Mr. Jackson did indeed have 2 scars would suggest that he may well have had these valve surgeries done at different times.